This morning, news that the FDA is on the verge of formally approving the Pfizer vaccine, a step that medical professionals hope will encourage unvaccinated Americans to get a shot. The New York Times reporting that the FDA could make the decision as soon as Monday. This as COVID deaths continue to rise, doubling in the last 2 weeks, now averaging more than 900 a day. Especially hard hit, the Gulf Coast, where a majority of residents are not vaccinated.
You're not going to get vaccinated?
Nope.
You're not going to wear a mask?
Nope.
You're going to keep doing what you do?
I'm going to live as a free American.
Packed bars and beachside parties in stark contrast to hospitals on the brink.
Our hospitals are underwater right now. It's really an urgent situation.
The only hospital in the Gulf Shores area now nearly double its capacity. The federal government on Friday deploying an emergency response team to aid the facility.
Here in Alabama, and we've got a reluctance here to be told what to do in some areas.
The hospitalizations in Alabama, Louisiana, Mississippi, and Florida all climbing. Many of the sick, children. More than 6,000 kids testing positive for COVID in Alabama in the first 2 weeks of August. Across the U.S., hospitals seeing an average of more than 1,200 children a day.
We've got children in the ICU, age range from 2 months to 16 years. 4 or 5 on the ventilator at any given time.
Troubling numbers as children return to school, where administrators and politicians continue to argue about mask requirements in the classroom. Back in Alabama,
where does this go from here?
I think we're going to get into a major situation. I'm afraid we're going to start losing people. I'm worried about our community.
And that is why we are seeing an increase in places now requiring vaccines. The University of Virginia said just yesterday that it has begun notifying dozens of students who have yet to comply with their requirement that they are now unenrolled for this fall semester. Vicki and Peter?
Vaughn Hilliard in hard-hit Alabama for us this morning. Thank you, Vaughn.
Good morning on this Thursday, September 2nd, 2001. Let it be known, you saw that video there, one woman declaring that she is free and she's an American. She doesn't have to get vaccinated. She doesn't have to wear a mask. Well, children are going back to school, and I would strongly suggest to that individual, that free American and all others, that being free also comes with a price. It also comes with responsibility. Wear a mask at least, even if you don't want to get vaccinated. According to Dr. Alan Jones, UMMC Associate Vice Chancellor for Clinical Affairs, the state of Mississippi healthcare is now within the time frame of total collapse. The trajectory he mentioned is the case positivity rate, the rate of new cases, the rate of hospitalizations occurring during what is now considered the fourth wave of the COVID-19 pandemic. Over the course of a week, Mississippi has broken its own case positivity record 5 times over, with the highest single day number at 5,048 reported on August the 19th. Deanna Tisdale Johnson of the Jackson Advocate has that story and more from Mississippi. She joins us this morning. And now, the news headlines. A Colorado grand jury has indicted 5 police officers and paramedics involved in the August 2019 death of Elijah McClain, a 23-year-old black man who was stopped by police while walking home from a store. He was put in a carotid hole, and injected with ketamine. 2 Aurora, Colorado Police Department officers, a former officer, and 2 Aurora Fire Rescue paramedics each face a count of manslaughter and criminally negligent homicide as part of a 32-count indictment. The 2 current officers also face assault charges and crimes of violent charges related to the assault. 2 paramedics each face various assault charges, including the use of a deadly weapon, that medication that they illegally inserted into McClain. They face crimes of violence related to the assault charge. The grand jury returned its results of the investigation on Thursday, the eve of the 2nd anniversary of Mr. McClain's death. Also in the news this morning, the World Health Organization announced it's monitoring a new coronavirus variant called MU, a strain that first surfaced in Colombia earlier this year. Mu is a variant of interest, the WHO noted in a news release. The variant contains mutations that indicate a risk of resistance to COVID-19 vaccines, and nearly 219 million people globally have now contracted the novel coronavirus since March 2020, when officials declared a pandemic. Over 4.5 million have died, including more than 657,000 in the United States, where the disease has disproportionately attacked the African American community and other communities of color. The pandemic also has led to a sharp decline in routine vaccinations, affecting traditional vaccines that prevent diseases like the measles, mumps, and rubella. Years, decades, and in some cases, centuries before Pfizer, Moderna, and Johnson & Johnson developed vaccines for the coronavirus, Americans routinely received those vaccinations to prevent such illness. We had a conversation with Gene Ransom, the Maryland State Medical Society CEO. He said the pandemic has had a tremendous effect on students' regular annual immunizations as they return to the classrooms. According to the University of Maryland medical system, pre-kindergarten immunizations fell at an astounding 76% last year. He said that the early childhood vaccinations, such as the measles, mumps, and rubella vaccine, are critical for stopping the spread of easily communicable diseases. Children routinely receive 2 doses for those traditional vaccines. The first dose at about 12 to 15 months, and the second dose when they're about 4 to 6 years old. So we see there's a broad effect of the coronavirus, but also a great point in that vaccines, we've been using them for decades, for centuries. Many of you who refuse to take a vaccine, take the vaccine to fight the virus, well, guess what? Many of you took the virus to prevent measles, mumps, rubella, polio. And guess what? Do you see cases of measles, mumps, chickenpox, rubella, polio? Not much at all. Folks, if you can, again, the National Newspaper Publishers Association really recommends vaccination. Let's try and get out of this pandemic. And speaking of pandemics, wow, down in, of course, Louisiana and, of course, Mississippi, they are being bombarded. They are being crushed because of Hurricane Ida, because of the storm system that continues to ravage them. It has come up north as well. In New York, at least 8 people died overnight as the floodwaters and tornadoes touched down in the tri-state area there. Everywhere you look, accidents all over the road. The Jersey Turnpike, cars in the southbound lane. Cars were driving north in the southbound lane to try and get away from walls of water. Everywhere you went, emergency crews were on the side of the road themselves. There were trucks in which you wondered how the truck driver was able to get out of his vehicle. It is complete devastation also now in the Northeast, particularly in the New York City metropolitan area. But right now, we're going to focus more on Mississippi, the Mississippi health care industry, what's going on there, and of course, the remnants of Hurricane Ida. We're going to talk to our publisher down in Mississippi, the Jackson Advocate, Deanna Tisdale Johnson. Good morning, Deanna. How are you?
Good morning. How are you doing?
It's always good to see you. Deanna, regardless of the situation, you know, people can always learn from you, Deanna, because there's always a smile on Deanna Tisdale Johnson's face. We appreciate that about you. Welcome to Let It Be Known.
I'm really glad to be here with you guys this morning. It's been too long since the last time we talked.
Yeah, it has been. And so, Deanna, first of all, how are things in Mississippi? We know we focused on Louisiana a lot, and understandably so, but we also know that just like with Katrina, Ida, you guys felt the brunt of that too.
Yes, right now we still have almost 150,000, 200,000 people without power along the coast of Mississippi in about 6 or 7 counties along the coast. And we in the Metro Jackson area got a little bit of wind and things like that, trees down, but we're doing much, much better than when we were in Katrina. So I'm hoping that, everybody will get their power back on. Everybody who needs access to, things that will help their quality of life, especially on the Mississippi coast, will get that in the next coming days. And then I also hope that people who have been affected in Louisiana on the coast will fare as well, because I know they have been hard hit by Ida.
Yeah, absolutely. And as most, if all our member publications in the Black press, you guys, regardless, come what may, you put your paper out. How difficult was that this week? Can you just, we know it was difficult, but can you walk our viewers through that?
Yeah, so during Hurricane Katrina, I remember that it was very difficult for us because a lot of us were out of power for months, some for a couple of days, weeks, into months. And I was fortunate enough to never go without power during Hurricane Katrina. So we all buckled down in my 2-bedroom apartment at the time and got the paper out there. And we just made contingency plans for this time because we didn't know what the weather would be. So we tried to make sure we had a lot of things done beforehand, just in case things didn't turn out to be, how we would have hoped. But luckily, by the time that it made it this far, Ida had turned back into a tropical storm, and we didn't feel the brunt of it. But we were definitely nervous. We had, I guess you would say, PTSD from Hurricane Katrina, because we aren't really used to seeing in the central Mississippi. We aren't really used to seeing a lot of hurricane damage, but Hurricane Katrina was just, it was something else. And we couldn't drive down the streets, because we get a lot of our oil from the Gulf Coast. The gas lines at the gas stations were 3-hour long waits. So it was really difficult for us during that time. So we were just bearing down and praying for the best this time. So we did a lot of work beforehand to prepare, but luckily Ida just said, okay, I'm not gonna be this strong coming through central Mississippi. So we were very fortunate.
Yeah, James Wright is watching. James writes for the Washington Informer. He says, I am an admirer of the Jackson Advocate and his fabled publisher, Charles Tisdale. I often put NNPA members to the Tisdale test, meaning can they weather the storms that paper has to fight for civil rights for Blacks? James, tipping his cap, Deanna, to you. Also, we see some folks, Deanna, they tell us about why they believe it's dangerous to take the vaccine. However, it should be noted once again that the National Newspaper Publishers Association, Dr. Benjamin Chavis, our president and CEO, Karen Carter Richards, our chair, and others in the hierarchy of the NNPA endorse taking the vaccine. And then when you see these young ones, forget about anyone else, but if these little kids don't move your heart, don't touch your heart, these little kids that are on ventilators, that are gasping for life, if that doesn't move you to want to try and protect them, then there's nothing we can say to you. Deanna, I want to get to the point of your article, this fantastic article you wrote for the Jackson Advocate and for BlackPressUSA.com. It's featured this week on BlackPressUSA.com. You talk about the Mississippi healthcare system failing amid COVID. What's going on there, Deanna?
Yeah, so you mentioned that, children are now getting sick, especially with the Delta variant. They have been getting sick before, but not at this rate. And so our flagship hospital, the University of Mississippi Medical Center here in Jackson, wanted to actually use the children's hospital, a part of it. They just built a new children's hospital and wanted to use a part of it for COVID patients. But now, unfortunately, a lot of those patients are children. So it's full, but it's not of, adult patients with COVID. It's full of children, some in the ICU and some on ventilators. We recently had an 8th grader from the south of Mississippi pass away from COVID. She had a headache and they took the test and then she died the next day, kind of thing. And so it's just heartbreaking when you hear stories like that, and it puts things in a different perspective. And I totally understand where the caution comes from, because when they first began talking about the vaccine, of course, I was a little hesitant myself.
Absolutely.
Even with information, I was a little hesitant myself and wanted to, see if okay, I'll wait a little while until I take it. But when you think about reason, when you think about the reasons to take it, there are more reasons to take it than not to take it. Because as we're seeing now, the people who are vaccinated are more protected. And the people who aren't, they make up 90% of the cases in Mississippi. They make up more of a percentage of that are in ICU, and they make up more of a percent of that are on the ventilators. And our chief healthcare officer at the Mississippi State Department of Health let us know that 1/3 of the COVID patients that are in the ICU and 2/3 of the patients that are on the ventilators will probably not be returning home. And so that is a large number, and it's overwhelming our healthcare system here in Mississippi. And we know that because the healthcare system has been failing Black people long before that, we're even more at a disadvantage as the entire healthcare system is failing in Mississippi.
Yeah, Deanna, speaking of vaccinated people, one of the first that I knew who got vaccinated was our president and CEO, Dr. Benjamin F. Chavis Jr., and he joins us right now. Good morning, Dr. Chavis.
Good morning, Stacey Brown, and salute to our distinguished publisher, the Jackson Advocate, Deanna Tisdale Johnson. Listening to you very carefully. Greetings from the NMPA and our chair, Karen Carter Richards, and all the 230 African-American owned newspapers and media comes across the country. We want you to know that the NMPA is with you and with the people of Mississippi, not only in our prayers, but in our support. We have 2 great newspapers in Jackson, the Jackson Advocate and the Mississippi Lincoln. We're so glad that you have able to be with us this morning on Let It Be Known.
I'm glad to be here.
Yeah, so Deanna, again, you talked about the system there, the healthcare system there. What is being done, if anything, to try and turn this around?
Well, the MSDH, the Mississippi State Department of Health, has actually led in the cause. If you think about it, there wasn't a clinic set up for the monoclonal antibody treatments. I don't think really in the U.S. yet. And so they're kind of leading the charge on that to try to mitigate the amount of people who are coming into the ICU because of COVID. So now they have, because they have a 2-person or 2 teams that are 23-person each, I think, from the National Defense. They're from the National Defense against, health disparities in the United States. And they have come down to help. They set up 2 field hospitals at the University of Mississippi Medical Center. And one of those they set aside some space to make sure that that is only for administering the monoclonal antibody treatment to people who have contracted COVID but are not sick enough to be hospitalized. And that has mitigated a lot of people getting to the point where they need to be in the ICU or they need to be on a respirator. And so that is one of the factors that they've been trying to implement statewide so that people will not overwhelm the hospital system. And so now the UMC has that. Our flagship community healthcare clinic, which is Jackson Hines Comprehensive Health Center, also has they don't have as many as UMMC because they're our flagship community center, but they're still not a hospital. And so they have a small amount of the monoclonal antibody treatment, but they are starting to get more. They're starting to help more clinics get the monoclonal treatment across the state. And so there's a process that you can go through, and they can train you and they can help you administer the treatment so that it mitigates people going into the hospital system. And so that is something that has been being done here that is kind of leading the charge from, what is being done nationally. And another thing is, just getting vaccinated. That's the number one defense that they're saying that you need to do is to get vaccinated. We see that those numbers are up. In July, we had, I think, about 19,000 a day were getting vaccinated, which was the lowest since the vaccines were available. But now we see them up in the 70,000 range a day. So people are going out. They're trying to make sure that people that they open more clinics so that people can get vaccinated. The Mississippi Black Caucus, the Legislative Black Caucus here, has been doing a campaign. And so we have, a number of things that people are being involved in to help mitigate the amount of cases that you see.
Yeah, great. Dr. Chavis, we've been discussing a number of things, but primarily with Deanna. She wrote an article about the Mississippi's healthcare system failing. And of course, as she puts in the article, there's nothing new to Black Mississippians. The article is found at Black Press USA, is on the National Newspaper Publishers Association's Newswire as well. She's really brought some really insight and some perspective to the situation there down in Mississippi. Dr. Chavis.
Well, Sister Tisdale Johnson is carrying on a great tradition. I knew her father. The Tisdale family has been involved with the Black press for many, many years, decades. And we appreciate your leadership. Again, can you speak about what you see? The turning point has not happened yet in terms of the COVID-19 in Mississippi and the disproportionate impact it is having on Black Americans. And there are other states, Florida, Texas, and several other states are having also, Arkansas, where disproportionately African Americans are dying. African Americans are on ventilators. And last year, Sister Deanna, the NNPA established the NNPA Coronavirus Task Force because we so believe that the Black press has to be the leading advocate in getting the truth about the vaccine, the truth about the virus. And, there's another variant coming now that they say is worse than the Delta variant. So people just got to really be vigilant, got to not become frustrated. I know it's been a long haul, but I would say that nothing is more precious than life. Nothing is more precious than one's health. And those of us in the Black press, including what you're doing, Deanna, across the country. You have to continue to be an advocate for our people to pay attention. When the system is not just broken, but the system is systematically structured to deny us health care, we have to find ways how to overcome that. So we wish all the people, and we are praying for all the people in Mississippi, as well as all of our brothers and sisters in all communities across the country, to continue to stay not only awakened to what the truth is, but to take action to protect everyone, not only as individuals, but protect everyone in the family. Because what we're finding, Deanna, can you comment? We're finding that families themselves are becoming impacted. It's just not one person in the family, that everybody in the family is in danger of getting COVID if you don't take the right precautions.
Yes, definitely so. In my article, I talked to Dr. Hersey Sullivan. She's been a family practitioner, solo practitioner for a while, but she's also worked in the hospital system. And so for her, she's seen, the disparities firsthand where, people do have help to get medical care, through Medicaid or Medicare, but sometimes it's hard for them to get to the doctor's office, because of transportation. That's one thing that we saw after the vaccine was released, is that it was hard for people to get to the places where they were administering the vaccine because of, transportation, and also because, some older people didn't have access to the internet. They needed to call, and those wait times to get an appointment through the calling system was 2 hours at a time. And so that was initially one of the first two battles for people to get the vaccine. But since then, they've done a better job. The State Department of Health and community organizations, community colleges like Jackson State, which is in the community of Jackson, has done a better job of partnering with different entities here to make sure that people can get vaccinated. But it's difficult if you, live below a livable wage. Some families are 8 to 10 people in a 1-bedroom apartment. And so how can they socially distance if one of them gets sick? Do they have sufficient water source to be able to wash their hands and things like that? I know that was a big challenge for us in March of this year when we had the storm, because many people in the Mississippi area, in the Jackson area, went without water for 2 to 3 weeks at a time during a pandemic. So how could they wash their hands? How could they wash up? How could they eat the foods that they needed to eat and things of that nature during that time? And so we have faced a number of challenges this year, but we remain hopeful. We remain hopeful that we will be able to get out of this thing. And the number one way to do that is vaccination, social distancing, wearing your mask, and being aware and conscious of others. I think we shouldn't give the disease, we shouldn't give this COVID-19 any more room to mutate. And Absolutely. We can do that by those steps that I just mentioned.
Yeah, and Deanna, we have about a minute and a half left. So real quick, is there an expectation that the aftermath of the hurricane will lead to an increase in new COVID cases as people have to shelter in place or take advantage of other shelter solutions?
Yes, I know that some places, like I said, are still without power right now. There are about almost 200,000 that are without power at this moment. And so that causes a challenge. I know some of the vaccination centers in those areas aren't open yet. So, people who will want to get vaccinated during this time that are in those areas aren't able to get vaccinated. And I don't know how that is also affecting the healthcare system there, because it's overwhelmed also at this time. So those are factors that also lead to more cases.
Yeah, absolutely. Dr. Chavis, your closing thought.
Well, my closing thought is, again, Sister Tisdale Johnson, our prayers are with you. And please give our regards if you see Jackie Hamilton, our National Secretary, who is the publisher of the Mississippi Link, and to both of you. I see both of you are just freedom fighters, you're publishers, you're truth tellers. And if there's any place in Mississippi where you're going to get the truth, it is the Jackson Advocate and the Mississippi Link. And please know that not only the prayers and support of all our publishers that stand with you, but let us know if there's anything else that we can do to help get the word out, help get help to Mississippi, particularly from the National Medical Association of Black Doctors, the National Association of Black Nurses. We can talk offline. We just want to, is there a particular website for people in Mississippi who are listening where they can go and get information? What is the website of the Jackson Advocate?
Our website is jacksonadvocateonline.com, and we have resources there on our website and on our social media platforms, which is on Twitter, Facebook, and on Instagram is Jackson Advocate.
Yeah, very, very good. Great to know. And thank you again, Deanna. Please follow the NNPA and Black Press of America on TikTok. We have a great young Howard University student who manages our TikTok account. It's NNPA, Black Press NNPA. So join us there on TikTok. And also, don't forget, it's coming up very shortly, the NNPA's National Leadership Awards reception. It's coming up on September 16th. Dr. James Hildreth is among those who will receive an award. And listen, Dr. James Hildreth, the president of Meharry Medical College and HBCU, he was on the board of the FDA, a Black man who approved these vaccines. It is safe, folks. Some may have some conditions that they feel like they don't want to take it. But listen, this is not about politics. It's not about Dr. Fauci. There are Black folks who developed this vaccine. Take the vaccine. It's saving lives. That's our position. And as our great writer out in Houston, Texas, Jeffrey Boney would say, don't argue with us. Take the vaccine and be safe. Kids are dying. Black kids are dying. We don't want any more of that. Thank you for joining us. Thank you, Deanna Tisdale Johnson. And as always, we are so privileged to have the boss with us, Dr. Benjamin F. Chavis Jr. We will see you guys tomorrow.
God bless.